to spend a few minutes highlighting one of the paths that the Canadian Vigor Centre's research has taken in the area of residual atherosclerotic cardiovascular disease risk and secondary prevention management, and how the CVC, by coordinating and supporting investigators and coordinators across the country, has had a local, national, and global impact. Low-density lipoprotein cholesterol, LDL-C, is an important cause of atherosclerotic cardiovascular disease and residual risk. Randomized clinical trials led by the CVC and in collaboration with Canadian pharmaceutical affiliates, global sponsors, and other academic research organizations have helped to identify specific LDL cholesterol thresholds in ASCVD patients. We've worked together to undertake randomized clinical trials to identify evidence that with novel non-statin LDL lowering therapies can help patients achieve specific thresholds or targets, and most importantly, experience fewer cardiovascular disease events. These include, in the last several years, the Improve It trial with the cholesterol absorption inhibitor ezetimibe, and a PCSK9 inhibitor, alirocumab, that can, from the Odyssey Outcomes trial, post-acute coronary syndromes, that can further lower LDL cholesterol and residual ASCVD risk. We've published a number of subgroup analyses that help to identify high-risk subgroups of patients who appear to derive the greatest absolute risk reductions with these treatments. And I believe that this has helped to inform not only Canadian, but also international guideline recommendations. In addition, together with one of my co-directors, Dr. Pad McCall, we've undertaken some population health research and looked at Albertan care and identified specific gaps in LDL cholesterol threshold attainment and ASCVD care in, again, real-world Albertan practice. Hopefully, these opportunities will lead to further investigations to close the care gaps by translating evidence-based medicine from randomized clinical trials that the CVC has helped to undertake, and also to better implement guideline-recommended therapies like ezetimibe and alirocumab that lower LDL cholesterol on top of statin into routine clinical practice. I believe this will have an important impact down the road on not only the care of Albertans, but also nationally in Canada and internationally around the world.
The clinical trial operations team at the Canadian Vigor Centre have been operationalizing cardiovascular clinical trials for over 20 years. Our work has covered a broad spectrum of phase 2, 3, and 4 trials, as well as registries and sub-study or ancillary projects within the trials. Having worked with many large pharmaceutical companies and also having navigated through a number of investigator-initiated and pragmatic trials, our team brings a wealth of expertise and experience in project leadership, site management, and monitoring. As with many trials over the years, the Canadian Vigor Centre partnered with our friends and colleagues at the Duke Clinical Research Institute on both Improve It and Odyssey Outcomes, 2 large phase 3 outcomes trials. In both of these trials, the Canadian Vigor Centre was responsible for leading operations and monitoring for Canadian sites. Not only did we achieve, but exceeded our recruitment targets in these studies. Based on our experience and the work we have done with Canadian sites, we always aim to ensure a good fit between sites and the trials.